Okay, everyone, thanks for joining. This is the third of our Health Well seminar series, webinars. Today we got a Vancouver-based sports chiropractor who's the founder of OMID Workplace Therapy and Wellness. Spends half his time doing workplace wellness, the other half seeing clients at his clinic in North Van. So presenting on joint health and longevity is Dr. Kamran Eghtesad.
I appreciate it.
Right?
Yeah, it's perfect. Thank you. I appreciate it. Can you guys can hear me clearly? It sounds pretty good.
Yep.
Sounds good. Okay, awesome. So I'm just gonna kind of share my screen, and then perfect. Awesome. And yeah, thanks for Ken for having me. And today we'll kind of go over a little bit of joint health and longevity, a little bit about myself. I'm a sports-based chiropractor. I went to SFU originally and then went down to California for my doctorate degree. And then right now I spend half my time seeing athletes in a large multidisciplinary clinic. And then the other half of my time kind of seeing a lot of desk workers working at kind of company headquarters. And I focus a lot on soft tissue, kind of the muscles around the joints itself, and exercise prescription. And I hope you guys are kind of wearing comfortable clothes. So at some point, I'm going to get you guys to do some movements and get moving. So yeah, being a chiropractor, a typical thing everyone kind of asks me is, can you Steven Seagal someone? And that's definitely something we can't do. For the most part, you know, chiropractic is very safe, and spinal manipulation, kind of the cracking and popping is safe if done with proper taking history and doing everything properly. Before I kind of dived into a little bit about joints and joint health, I kind of want to talk about the human evolution and how we kind of got here. And so, you know, for millions of years, we've been hunters and gatherers, and the debate is, were we gathering, you know, fruits and vegetables, or were we gathering mostly animals and meats? You know, I'll leave that up for you guys. But generally, we were moving a lot more than we are now. And now, kind of these last few hundred years, we're more sedentary and not moving as much. So as a society, what we essentially did is we came up with exercise as being kind of this mitigating risk factor to kind of reduce the risk of this stuff that we're not doing as what we were doing before. So I'm sure at some point everyone's seen this ideal sitting posture. You know, from your office, you know, we have now these representations in sitting, we have them in standing, where, you know, the most ideal position being in knees 90, hips relatively at 90, and in this position. But in reality, this is what we're mostly like. We're favoring one side, we're slanted over, and we're definitely not anywhere close to that position, which is fine. And the reason being is, originally we had thought that if we had the most ideal sitting posture, then we'd be good. We wouldn't have to worry about anything. But now that with more research coming out, it's not necessarily having the best sitting posture, but having more movement throughout the day and having these micro breaks. So what we can do for our joints really is try to take as many breaks as you can throughout your day. And a great way to do that, what I tell people to do, is drink a lot of water. That'll force you to get up, and it'll force you to use a bathroom, and it'll force you to give yourself a break. So a little bit about kind of the anatomy of the joint. I don't know if you guys can see my cursor, but what we're looking at is just a basic synovial joint, which means two bones coming together, which creates this articulation of these two bones interacting with each other. So we have one bone on top and one bone on the bottom, and around these two bones is the capsule, which encapsulates this fluid that allows us to get nutrients into the very deep part of the bone, to the deep part of the joint. So if you guys can see these really like where it says smooth cartilage, these parts of the bone actually don't have a lot of blood supply. So we need a movement of our joints to bring oxygen and nutrients in and be able to take the waste products that's being produced, taking these out. And that's kind of what these 2 points are saying. You know, we're allowing more oxygen to come in, more nutrients to come in, and then allowing to take away these waste products. So I came up with this slide, and I promise you I was sober when I came up with it. But so what I want to explain to you guys, something I think about, and maybe you guys haven't thought about it, but how does your joints perceive you in your environment, right? So for example, us being in this environment now, being during quarantine, it's hard and it's not the most ideal environment to be in. But do you ever consider how your joint feels with your actions, by your actions, what kind of environment you're putting it in? So I want to just kind of take maybe the shoulder as an example, and I'll take myself for an example. You know, I got up this morning and, you know, had some breakfast, you know, very minimal shoulder movements, and you know, I kind of got these slides together, and now I'm doing this presentation. Later, I'm going to maybe go and maybe do 1 hour workout, and then wrap up my day, maybe have some beers, watch some Netflix, and take it easy. If you want to think about it, how our joint perceived that day, it probably didn't have the best day. It didn't get to explore as much as it could explore. It didn't get all the feedback it could have had. It just got maybe a little bit my joint, my shoulder in front of me, or maybe a little bit to the side. Maybe it never even went up top. Maybe it never went back. So definitely not the most ideal situation for the shoulder. So when we have these days and these weeks or even months where we have lack of movement, that's what is really going to lead us to pain. And that's what really, it doesn't allow us to create a capacity for us to handle the pain. So if something happens, an amount of force goes into a joint, and if your joint doesn't have that capacity to handle that force, it's going to get hurt. So I'll dig into that a little bit more. But before I dig into that, I wanted to go over something called controlled articular rotations, which is what we're going to do. And I'll get you guys to go through these movements. It's essentially all it stands for is slow joint circles. So what I mean by that, so I'm going to actually get you guys to can do this with me. Awesome. So I'm going to do is we're going to go through a couple of these things, the slow joint circles. So if you want to stand up, you're welcome to stand up. If you have a wall next to you, that's great. So I'm going to go over the shoulder, the neck, maybe we'll do hips and ankles if we have time. So what we're going to do is the best way to get all these nutrients and oxygen into our joints is to give it as much feedback as we can. The best way to give it all this feedback is to do a full rotational movement of that joint. So what I want you to do, first what I'm going to do is we're just going to do the shoulder. So what I want you to do is I want you to find a wall if you have a wall. If not, it's totally fine. And what I'm going to do is I'm going to get you just put your hands on your side and have your thumbs facing forward. Okay? So what I'm going to do is I'm going to get you to slowly bring your hands up and try to bring your arm as close as you can to your ear, but without tilting your head. And you're really squeezing when you get to the top. You're really squeezing, and you want to make sure your ribs aren't flaring and you're not using your back. Once you get to the end, so what I want you to do is I want you to spin your hand so your thumbs are facing forwards. And what you're going to do is as you're going back, you're going to slowly continue to rotate your thumbs back. So what this does is we're creating as much feedback and fluid movement in that joint. And a good way to gauge this is if you use a wall, the closer you are to the wall, the harder it's going to be. The farther away you are from the wall, the easier it's going to be. So again, I'll do the other side. I'm going to be slowly coming up, and as I'm doing that, I'm pushing slowly bring it back. How'd that feel? Thumbs up if it felt okay.
I didn't get it because you were bleeping out on me.
Should we do it one more time?
Can you just repeat the whole, the wall, you're pointing your fingers towards the wall, or you're getting your shoulder, get this part close to the wall?
Sure. So again, it's going to be easier the closer we are. Sorry, it's going to be harder the closer we are to the wall. It's going to be easier the way
In regards to the
farther we are from the wall.
In regards to the rotation,
So my thumb's going to be facing forward. Yeah, sorry, go. The rotation part, repeat the rotation part.
So the closer so the whole point is to have the rotation as close to the body as possible?
So yeah, so the closer we are to the wall, the harder it's going to be, because we're going to have to, as we're rotating, our arm is naturally going to come out. So the way to challenge ourselves is by going closer to the wall. And that really.
Yep.
Okay,
Sorry,
perfect.
freezing.
Perfect. Okay, we'll go through another joint. So the purpose of these isn't really to give you guys specific exercises to do. It's more of to show you the concept of doing these exercises, and they really can be replicated for any joint. So let's go. We'll do a couple for the hip. So what I want you to do, same idea. If you have a chair or wall for balance, you can kind of use that. So what we're going to do is same idea. We're going to make as big a circle as we can with our hip only. So as we go through these movements, be careful to not be leaning forward and back. And all the movement I want to come from your hip joint right here. Okay? So I'll get you guys to put your hands on the wall for support. And then, so we're going to take one hip and we're going to drive that hip as far up as we can. Sorry, I shouldn't have worn black. So we're going to drive that hip up as far as we can. Once we get all the way to the top, we're going to slowly drive that knee out. And as I'm doing that, I'm continuously driving that knee up. Okay? And then once we're there, I'm going to rotate my knee, but try to keep that knee up as high as I can and make a big circle and come all the way back around. Okay? We do it for the other side. Okay? Again, you're going to use a wall for support. You're going to drive the knee up as far as you can. Good. Drive the knee out as far as you can. And again, I'm staying square from wherever I started. You're going to rotate the hip inwards. And then you're going to do a big circle back. I'm just going to check the chat. Okay. Was that clear? Did it cut out at all?
That one was clear. Okay.
That one was clear? Okay, cool. Any questions on that? Does that kind of make sense? Is the popping sound okay during rotation? That's totally fine. The popping sound is most of the times tendons deep in your hip that will kind of flap over bone. It could be a little bit of these deep sacs we have that could move around and make noise. As long as it's not causing any pain, it's totally normal. And you should continue to do those movements. If you start to tilt, should you lower your knee? Yeah, for sure. So if you're doing it and you start, so the whole point of this is to get the movement from here, right? So if you're going and you're rotating your knees and you're tilting this way, that means you're not creating the range of motion from here. So I want you to just go as much as you can without compensating for that. Awesome. So again, the idea was we just took that joint and did as big of a circle as we could to allow the most amount of nutrients, oxygen into that joint. Okay, let's do one more. Let's do our ankles. Okay, so I'm gonna get you to sit on the ground. Okay, so what you're gonna do is we'll start with the right ankle. So what I want you to do is I want you to take your left hand and swing it under your leg and hold on to your biceps. So it just allows your foot to float in the air. Okay? And then what I want you to do with your right hand, I just want you to just put it on top. So same idea. All we're trying to do is we want this ankle to go through a full circle, getting as much range of motion in that ankle. But the reason why I have my hand on top of my shin is to make sure that I'm not getting the movement from this here, and I'm only getting the movement from the ankle. So what I'm gonna do is I'm gonna start bringing my ankle up as far as I can. Good. And as I'm doing this, I'm pushing pretty hard. I'm pushing almost 80% effort and really squeezing hard. So I'm gonna push my ankle up. I'm gonna slowly go to the right. I'm gonna slowly go down. Good. Big squeeze, squeeze, squeeze. Now slowly going to the left. Good. And slowly coming back up top. And then let's go the other direction. Good. Big squeeze, squeeze. And all the way on the down. Good. Pulling the ankle right. And back to center. Okay. Let's try with the other side. And this should be pretty, it shouldn't be easy. It should be, you should really be trying to push it and really get as much movement in that ankle as you can. So same idea. I'm going to flip my hands. Good. So my right hand is going to go over my left, under my left knee. I'm going to hold on to my bicep and just put my hand up top. Good. It's just going to help me float my ankle in the air. And again, we're going to do a big circle. We're going to bring the ankle up. Good. Ankle towards the left. Big circle, really squeezing. And back. Good. And slowly going back in the other direction. Really, really squeezing hard. Good. And back. Okay. Okay. Any questions on that? How did that feel? Okay, cool. Felt good. Okay. Awesome. Okay, so again, that was kind of the movements I wanted to show you. Let's do one more. That was great. I guess the ankles and this will be useful. Awesome. Perfect. So let's do one more. Let's do the neck. So you can do this sitting or standing. It's up to you. So I'll probably sit for it. So what I'm going to get you guys to do first is same idea. We're going to do as big as circle as we can. So what first thing we're going to do is I'm going to get you to make a double chin. Make a double chin and then slowly start looking down. Good. And as you do that, now I want you to bring your chin towards your right shoulder. Good. And now bring your right ear towards your right shoulder. Good. And now I want you slowly rotating back. Good. Bring your left ear towards your left shoulder. Tuck your chin in. And slowly come back to center. Okay. Now let's go the other direction. So again, same thing. We're going to tuck our chin in. Look all the way down. Our chin towards our left shoulder. Good. Left ear towards left shoulder. Make a nice big circle. Good. Right ear towards right shoulder. And all the way back down to center. Okay. Did anyone have any pain or discomfort with any of those movements that we did for the ankle, hip, or neck? Any discomfort? How'd those feel? Felt pretty good. Okay, awesome. Okay. Your neck was sore when my head was back. Awesome. So the neck being sore when your head is back. So what I tell people is you should be doing some sort of rotational movement with your joints every day. And that's usually a good indicator of if you need some sort of therapy. So a lot of people ask, when do I need to go see a massage therapist, a chiropractor, a physiotherapist, if you have nothing going on? Doing these is actually a good indicator to, hey, there might be something going on that I should go see someone. Because what most people tend to do is they will wait till things are fully broken, and then they're like, okay, I'll go see someone. So it's definitely a good idea to do these almost every day and get some good feedback from these. And the reason why you're getting that pain when your neck is going back is because your joints are in like their most locked position. So you might be getting some joint irritation at that very end part of looking all the way back, which is pretty normal. Most people have some sort of joint restriction in that part of their neck. So again, so why do we do these cars? Again, so if we do any sort of training and you gain ranges of motions with those types of trainings that you do, it's good to do these cars. It'll help you to maintain the ranges of motion, and it'll help even prevent calcification buildup in our muscles and tendons. Usually what happens specifically in the shoulder with lack of movement, especially in greater ranges of motion, we'll get actually calcium buildup in some of our tendons, the quote unquote rotator cuff tendons. And other things, it'll help prevent osteoarthritis, osteoarthrosis, and it'll have just natural anti-inflammatory mechanism by allowing the fluid in and kind of get things moving. So again, reduce injury, give feedback, and then improve range of motion. And we already talked about how it can be used as a screening tool to when to go see a therapist. So one thing, sorry, I'm trying to see who's in the chat. Do you suppose to feel? Yeah, so the question is, are you supposed to feel muscles stretching during these movements? And for sure, yeah, you'll definitely feel muscles stretching throughout these movements. But the goal of these movements aren't necessarily for the muscles that tend to be more superficial, which means closer to the outside. The point of these is to do more deep, kind of getting the deep stuff in our joints, getting them moving. What about knees that don't rotate? Yeah, for sure. Someone asked, what about knees that don't rotate? At the end, too. So yeah, so do you have the prerequisite for the exercise you want to do? So what I mean by that is a lot of times before we go straight into doing an exercise, we want to make sure your joints are capable of doing it before you start putting weight on that exercise. So I'll give a couple examples. A lot of people nowadays, they go on Instagram and they see people doing handstands, and they really want to do handstands now, which is awesome. But before I say you jump in doing the handstands, can your wrist even get into that position without putting any weight on it? So what I mean by that is, for example, can your wrist even go to 90 degrees actively before you start putting weight on it? So if you look at a wrist and your wrist only goes about 45 degrees, I would say it's too soon. Like this is where another time where you would seek kinesiologist or someone to gain that range of motion before you jump into doing handstands. And that goes with almost any movement. Another common one is overhead squats. So if you're doing an overhead squat and you bring your arms all the way up, and if I can't see your ears when you bring your arms all the way up, I would say it's probably not the best time to do overhead squats yet, because your shoulder can't even get into that position. And if you now put weight on that position, all you're going to have to do is kind of compensate for it from your mid back. So that's ideally why we want to look at these prerequisites before we jump into the exercises. Cool. And when it comes to joints, a few other definitions and things to consider. There's a lot of different definitions and flexibility versus mobility, but in general, flexibility being more passive, which means if you go into a stretched position and you hold that stretched position for a long time, you generally don't have a lot of control in that range of motion. And mobility being kind of the opposite of that, having that range of motion, however, being able to achieve that range of motion actively. A really simple formula I like to kind of show people and I tell people is with all these things that we do, we try to have as much capacity as we can in our joints. So if your joint can go back behind your head and you can actually generate some force in that area, it'll be less likely if you fall on ice and your shoulders go back and reach something to grab something for you to injure yourself. So as long as the load, so if we look at the last formula, if the capacity of your joint is greater than the load, you're not going to get injured. And so we have a couple defense mechanisms in place when a load is presented. So the first thing that kind of acts as a defense mechanism is our muscles and our nervous system that we control. So first step of our defense mechanism is that muscle, you go into a position you don't like, and your muscles and your body pulls you out. You're fine. But if you don't, but let's say the load exceeds that, the next level of the defense is our ligaments. That's where people say, "Oh, I tore this ligament," or I have a sprain, or have a hamstring strain. That's when it goes one level deeper. And then the last line of defense is bone, where if you pass the muscles and the ligaments, you go into a bone. That's when someone breaks the bone, essentially. So very famously said by Steve Carell, if you don't use it, you lose it. And that kind of plays along for all of these. With a lot of these movements and these joint circles, and if your arm isn't going in this back direction or your hips, if you're not going into these in this workspace regularly, you're going to slowly start losing that range of motion. So again, recommend doing the cars as often as possible. And again, just a general overview. It's kind of the movement is the key, doing the cars every day and using it so you don't lose it. And okay, so what I'm going to do is I'm going to go over some knee stuff. If you guys can look, we'll do some stuff with our knees too. So the question was, how do we do it for the knee, where the knee doesn't have So how do we do it for the knee where the knee doesn't rotate? Which is great. The major movements of the knee is kind of this back and forth movement, but we can still get rotational aspects of this. So a way to do it is, now what we're going to do is we're going to go back into that same position where we're just kind of doing something to hold the knee up, right? So now what I want to do is I want to rotate my shin bone relative to my knee. So I'm going to rotate my shin as far as I can to the outside. Good. And then I'm going to straighten my leg as far as I can. Good. And now I'm going to rotate my shin as far as I can inwards. Good. And I'm going to bring it back in. And then I can repeat that, becoming a circle. Good. I'm going to rotate my shin outwards. Good. Straighten the leg. Good. Squeeze and rotate my shin towards the inside and coming back down. Good. And now I can do the same rotational aspect going the same direction. So I'm going to keep it towards the inside. Good. I'm going to straighten my leg. Good. I'm going to rotate my in this kind of is harder to do, but even with doing squats with no weight, I froze. Should I do it again? One more time? Okay. Okay. Okay, so again, same thing. I'm just kind of going in this position and we're moving the shin relative to the knee. So we're going to rotate the shin towards the inside. And again, I'm just doing a big circle. Going up, rotating the shin outwards, going down, and then same thing. And then rotating it back around. So again, that will help to create that rotational component of the knee. How was that? Is that clear? Yeah, I got one thumbs up. Perfect. Awesome. Cool. Awesome. So I'm just gonna, yeah. So again, just to kind of give you guys an overview, this can be done for any joint. You can do it for your wrists. You can do it for your elbows. You can do it for really anything to kind of to get that synovial fluid, that fluid in the joint moving as much as you can. A typical regimen is doing it once right when you wake up. And when you wake up in the morning, you can kind of, if you're doing your wrist, you can kind of go through it nice and slow, not really pushing it too much. But as you go through the day, you can slowly start pushing this and making it more intense by really squeezing it and rotating as much as you can. And then by the end of the day, you can go almost like 100% and really pushing it hard. All these things will help mitigate the risk of injury, and again, this is one component of kind of keeping your joints healthy and kind of improving longevity. And the stuff that Kent does and Symmetrix does is also another component that kind of adds on to it and makes things better. And yeah, that was my presentation. I hope you guys enjoyed it. If you guys have any questions, how many times per?
I think we got a fair amount of time, Kamran.
Yeah, so I would say minimum 3 times a day, and you want to ramp it up as you do it. So again, morning, middle of the day, and at night. And if we're doing it in terms of intensity, maybe 20-30% intensity the first time, and then 50-60 the second time, and then close to 100% the last time. And it can definitely also be as like a good warm up to get your joints moving before you kind of get into it.
Cool. Well, I want to say thanks a lot, Cameron. That was a great presentation, well delivered. Really appreciate learning a bit more about joints. And I had a question for you about movement. What are the other risks of not moving your joints enough? I mean, joint health in general and longevity is better if you move them, but is there something that can happen besides the extent of rotation?
Yeah, so with every joint, it's a little bit different. So if we take the spine for an example, lack of spine movement, lack of, like, for example, even thoracic extension, kind of going on a foam roller and extending back and all these different exercises. Lack of these movements and these, even if it's only through one plane, you degeneration will happen sooner, which is kind of generally wear and tear will happen sooner. And wear and tear necessarily doesn't have a correlation to pain. Can't really say if this person has wear and tear, they'll have more pain. But the wear and tear in general has negative effects. And that's when we have wear and tear, we get lack of movement. When we have lack of movement, we have compensation patterns that occur, which kind of goes down this kind of the spiral. And for example, even for shoulders, lack of movement tends to lead to adhesive capsulitis, known as frozen shoulder. And yeah, so with every joint, it's a little different, but definitely there's more ailments and more prevalent injuries with lack of movement.
Thanks. Yeah, I'm going to sign off and stop the recording. It looks like there's another question in the chat, but I did want to thank you very much, Cameron, for the presentation. Thank everyone for joining. I see some familiar faces here. Lois, Lynn, Yulia, Terry, Lillian, thank you so much for joining us. And really appreciate you delivering this, Kamran.
Yeah, thanks a lot. Thanks for you guys' time, and I hope everyone enjoys their Saturday.